Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in diffuse esophageal spasm, diagnosis of diffuse esophageal spasm. Right. Diagnosis of diffuse esophageal spasm. We can do a barium swallow for diagnosing diffuse esophageal spasm. In the barium swallow, see, because there are many high amplitude contractions which are seen and they are repetitive. Here, the barium swallow looks something like this, which is called as presence of corkscrew appearance. It is something like, it looks like a corkscrew, so there is presence of corkscrew or rosary bead appearance, or there can be segmental spasm may be seen with pseudo diverticulosis appearance is seen on the barium swallow. Why is all these present? Because of the presence of the tertiary contractions we see this corkscrew appearance or rosary bead appearance. If this corkscrew appearance or rosary bead appearance is present, then it indicates that there is advanced disease is present. Then one more important thing is gold standard investigation is manometry. Manometry is the gold standard investigation for the diagnosis of diffuse esophageal spasm. Okay, so in the manometry, the main findings are, you will see that there are simultaneous multi-peaked contractions will be seen at high amplitude, something like that. Simultaneous multi-peaked contractions will be seen at high amplitudes. How much amplitude? That amplitude should be more than 120 millimeters of Hg, and those amplitudes are also of longer duration. That is simultaneous multi-peaked contractions of high amplitude of more than 120 millimeters of Hg, and they are also of long duration of more than 2.5 seconds. And here these contractions are erratic, that is they are so more that they occur often. More than 20% of wet swallows are associated with this simultaneous multi-peaked high amplitude contractions in diffuse esophageal spasm.
thank you and thank you for watching.